My name is Amy Pope. I am the Deputy Homeland Security Advisor here at the National Security Council at the White House. And we have a wonderful event planned for you at this very early hour. And I hope you can take the opportunity to further all of the really, really great work that you and your companies are accomplishing in the name of antibiotic stewardship. I want to thank you for coming to today's forum. I want to thank you for the very important commitments that you all have made here today. And I would like to welcome Dr. John Holdren, who is the Assistant to the President for Science and Technology Policy and the Director of our Office of Science and Technology Policy, to the podium to begin today's forum.
Well, thank you, Amy, and good morning, everybody. I'm grateful to all of you for getting up early enough to attend this remarkable forum, beginning, as Amy has noted, at this early hour. I want to welcome you to the White House, not just on my own behalf, but on President Obama's behalf. He puts a high priority on this issue, and we're all just delighted with the turnout and with the commitments. I want to acknowledge and thank Secretary Burwell, Secretary Vilsack, who will be appearing momentarily, CDC Director Tom Frieden, and all of our distinguished panel members and guests for being here today. Your presence here and the commitments that you have made are, I think, compelling testimony to the importance of combating antibiotic-resistant bacteria and addressing one of the more complex challenges we face in the public health space here in the United States and around the world. I say it's complex because there are many drivers of the emergence and spread of antibiotic resistance, and a number of those drivers remain poorly understood. What we do know is that we cannot let this grave public health threat go unaddressed, killing tens of thousands of Americans each year, many more around the world, and affecting millions. In addition to classical infection control strategies, from hand hygiene to operating room practices, the single most important action to slow the development and spread of antibiotic-resistant infections is to change the way antibiotics are used. Antibiotic stewardship, the development, promotion, and implementation of activities to promote optimal use of antibiotics nationwide, is the theme that has brought us all together this morning. The White House is hosting this forum in recognition of the importance and the complexity of the antibiotic resistance issue, the management of which requires multifaceted strategies that involve multiple sectors of society. Today, we are uniting leadership from the human and animal healthcare system, the pharmaceutical, diagnostic, and vaccine industries, scientific professional societies, the livestock industry, food processors and retailers, and government. Cooperation among all these sectors is essential to confront the threat posed by antibiotic-resistant infections. This room is filled with people who have been leading the push for the judicious use of antibiotics for years and, in some cases, even decades. I thank you for your continuing engagement as we seek to expand the programs that implement antibiotic stewardship practices in humans and animals. The commitments that you're announcing today prove that a broad community is determined to address the antibiotic resistance crisis. Today's commitments also demonstrate the power of voluntary action to effect sweeping change, just as did the pharmaceutical industry when it stepped up and voluntarily removed animal growth promotion from antibiotic labels following the FDA issuing guidance on that topic in 2013. As I've already said, the President has made combating antibiotic-resistant bacteria a priority and has set forth the strategy and action plan by which the federal government will do its part to preserve the efficacy of our existing antibiotics while promoting the development of new diagnostics, new generations of therapies, and expanding the use of vaccines to prevent diseases in humans and in animals. Today, the President will issue a memorandum declaring that it's a policy of the federal government to encourage responsible uses of medically important antibiotics in the meat and poultry supply chain by supporting the emerging market for meat and poultry that have been produced according to responsible antibiotic use policies. This policy builds on the important work of the Food and Drug Administration, antibiotic manufacturers, veterinarians, food suppliers and retailers, and farmers who are already taking substantial steps to phase out the use of medically important antibiotics for growth promotion in livestock. Within 120 days, the General Services Administration will initiate a process to make meat and poultry produced according to responsible antibiotic use policies available in federal cafeterias managed by the GSA. In the coming years, as meat produced under responsible use practices becomes more readily available, each agency will develop and implement a strategy that creates a preference for awarding contracts to vendors that offer as an option meat and poultry produced according to responsible antibiotic use policies, and that will be true in domestic federal cafeterias for civilian federal employees and visitors to the extent that such an option is available and cost-effective. Finally, by 2020, appropriate rulemaking will be used to implement a preference in federal acquisitions for meat and poultry produced according to responsible antibiotic use policies, served or sold in all federal facilities, allowing for exceptions to ensure that acquisition of such products can be made at fair and reasonable prices and within a reasonable time frame. We're already putting this into practice here at home. Beginning last week, the Presidential Food Service at the White House has committed to serving only meats and poultry that have been produced with no hormones or antibiotics. Again, let me thank you for being here today, for your efforts, for your commitments. I hope you find the discussions ahead to be productive and effective in moving us toward our shared antibiotic stewardship goal. Let me now invite to the podium Secretary of Health and Human Services, Sylvia Burwell, for her remarks. Sylvia.
Thank you, John, and good morning to everybody. And thank you all so much for joining us today for what is an important and hopefully historic step to protect the health of our nation as well as our global community. Among my friends and colleagues, I am known for being analytical. I'm a numbers person. And after a long day, I actually like to curl up with a few budget briefings and a cup of tea to relax. Since I've worked on the issue of antibiotic resistance for a while, both at the Gates Foundation, at OMB, at Walmart, and now at HHS, I've often seen it in terms of the statistics. And by that measure, this challenge is most upsetting. And every year, at least 2 million people become infected with bacteria that are resistant to antibiotics, and 23,000 people die a year. But the issue is much more than numbers, and for me, I saw this come to fruition in terms of human cost in April when my uncle was diagnosed with MRSA, and it led to and exacerbated complications that eventually led to his passing. And as we marvel, and so we know that this is not just about numbers, but it is about people too. And I think that's part of what's helping us gain traction on this effort. As we marvel at the advancements of medicine, it's sometimes hard to believe that just 75 years ago, something as simple as a cut in the hand could lead to your own death. And the discovery of penicillin and antibiotics put a stop to that stark reality, but it also did much, much more. It opened the door to the world of modern medicine. With the ability to fight common infections, we didn't just make surgery safer, we made organ and bone transplants possible. Chemotherapy or treatments for rheumatoid arthritis, anything that heals us while weakening our immune system is only possible because we have the tools to fight the accompanying infections. So antibiotics have been called miracle drugs, and it's not really hard to see why. But like other miracles, they sometimes don't last forever. And unlike most medications, antibiotics lose their efficacy as the infections they attack evolve and learn. Dr. Brad Spellberg, author of Rising Plague, put it this way: antibiotics are the only class of drugs where the more we use, the more rapidly we lose. For every prescription that isn't completed or wrongly prescribed, we risk enabling the adaptation that will render us defenseless. Overuse and misuse are rampant, complicated by the fact that many antibiotics are used for both humans and food-producing animals. As all of you know, and as we've all been warned, It's already happening. We're not entering the post-antibiotic world. We're actually in it. And some of you have heard the story of Addie Rarasich, the healthy, active 11-year-old from Tucson, Arizona, who landed in the hospital with a bacterial infection. After months of battling drug-resistant bacteria, her doctors were forced to do a lung transplant. It's a terrifying thought for a mother, and worse still, to know that many won't be as lucky as Addie. In the hospitals across our country and in cities across the world, this threat grows. Still, our greatest threat isn't adaptation. It's actually our own inaction. And that's why all of us are here today. The challenge is great, but so is our will to meet it. Last September, we issued the National Action Plan for Combating Antibiotic-Resistant Bacteria, our CARB plan. And I'd like to thank everyone here today, from the task force who worked so hard to those who helped us think about that plan and draft it. It's a research-driven plan to identify, prioritize, and coordinate investments that prevent, detect, and control outbreaks to resistant pathogens. It will ensure the continued availability of effective therapies, detect and control new resistant bacteria, and accelerate our national response. And perhaps most importantly, this plan recognizes that one department, even one government, or one company will not solve this problem alone. We must work in collaboration, and we will. HHS is home to many of our efforts to combat this problem. At CMS, the Center for Medicare Services, in collaboration with CDC, Center for Disease Control, I have a department of lots of acronyms, and other professional organizations, we're working to create regulations for antibiotic stewardship programs for acute care and critical access hospitals, as well as long-term facilities. When in place, what these regulations will do is reduce harm that might arise from overtreatment with antibiotics, while enabling patients to receive effective antibiotics for illnesses for bacteria when they're actually needed. CDC is also working to expand antibiotic use reporting under the National Healthcare Safety Network. The system allows hospitals to track their antibiotic use, and in time will help the nation benchmark progress on antibiotic stewardship. In April, the VA system began reporting antibiotic use data to CDC, and several large health systems represented here today have already begun or will start reporting antibiotic data use this year. To support stewardship of these drugs in livestock, the FDA has proposed a regulation to enhance reporting requirements for sponsors of antibiotics approved for use in food-producing animals. FDA is collaborating with the CDC and USDA to collect more information on use and resistance at the farm level as well. More data is critical for us to measure and promote the judicious use of medically important antibiotics. Today, the FDA is announcing changes to the Veterinary Feed Directive regulation, which outlines requirements for veterinary oversight of the use of drugs in animal feed. Putting antibiotic use under the oversight of veterinarians is an important step in combating overuse. We are also sponsoring a competition with a $20 million prize for the development of a successful rapid point-of-care diagnostic test for providers to combat the spread of antibiotic-resistant bacteria. We're excited about this challenge, and we think it could lead to a real breakthrough. These efforts will support others happening across the government, from the Department of Agriculture to the Department of Defense. We are also working with nonprofits and those in the private sector and seeing good progress. Ascension Health is collaborating with CDC to establish facility-based antibiotic stewardship programs in all of their hospitals. And Tyson's Foods has recently announced it will eliminate the use of human antibiotics from its U.S. chicken flocks by 2017. Many of you have made similar and very important commitments to support this effort. From hospitals and health systems to food producers and retailers, we are partnering with key leaders like you in human and animal health. This challenge requires big solutions, and I want to thank you for stepping up. Your support is critical to success. I was recently in Geneva for the World Health Assembly, and I can report back that it is not just a priority here in the U.S., but it is a priority that has caught the attention of the entire world. The WHO's Global Action Plan on Antimicrobial Resistance, which just passed this session, requires that each country create an antibiotic resistance national action plan, as we have done. We have many international partners in this effort, including countries and multilateral organizations, and we are building the momentum we need to fight this fight. And I know you all in this room understand the need for action very well. The threat is real. The time to act is now. We know that lives are on the line, but we can meet this challenge and we will find a solution. Together, we will win this fight, and our road to victory starts here today. Hope you all enjoy the session, and thank you for being here. And now, I'd like to introduce my colleague, CDC Director Tom Frieden. Thank you, Tom.
Good morning, everyone, and thank you so much for being here. Thank you for responding to this call to action. Drug-resistant bacteria is a serious problem. It's a problem that could result in the medicine chest being empty when we need it most. And it's a widespread problem. It affects every community and potentially every patient. It's not too late to turn it around. We don't want the miracle to be over, the miracle of antibiotics. And unless we take action now, that is a significant risk. As you've heard, 2 million Americans get sick from drug-resistant bacteria each year, and 23,000 die. There are an increasing number of deaths from an organism called CRE, or carbapenem-resistant Enterobacter. This is a true nightmare bacteria. It spreads from patient to patient, from organism to organism, and it kills up to half of the people with bloodstream infections with it. C. difficile, which is caused almost always by use or misuse of antibiotics, kills another 15,000 Americans each year. And these infections can be horrendous for patients and for families. Today we have with us 3 families, the families of Peggy Lillis, Niall Moss, and Josh Nahum. They're here with us today, and I want to salute them for bringing their stories into the public to help remind us and motivate us of the importance of the work that we're doing here today to protect others. Thank you for what you do. Christian Lillis lost his mother, Peggy, after she received antibiotics for a routine outpatient dental procedure and contracted a deadly C. difficile infection. She was previously healthy, and she was sick for only 6 days. Carol Moss's son, Niall, didn't receive antibiotics in a timely manner and lost his life to MRSA, or MRSA pneumonia. He was only 15 years old. Victoria Nahum's son, Josh, was hospitalized after a skydiving injury. He was on his way to recovery, but ultimately died of a gram-negative infection for which we have few or no antibiotics available. These 3 stories represent some of the challenges we face in antibiotic use. Some patients receive antibiotics unnecessarily, while others may not receive them promptly enough. And there are now infections out there for which we have few or no antibiotics. It used to be that there was thought to be a friction between what's best for me and my patient and what's best for the community at large. But it's now clear that the interests are truly aligned. What's best for my patient is the same as what's best for the community. Not the most antibiotics, not the most wide spectrum antibiotics, but the right drugs at the right time for the right patients so that we'll have them when we need them. If we don't take better care of the antibiotics that we have today, if we aren't better stewards of them, we could lose these antibiotics and the next ones that come along. If we lose antibiotics, we undermine our ability to safely care for the 600,000 Americans who get cancer chemotherapy each year, patients who need organ transplantation, or many other things that are routine in modern medicine. We truly risk undermining much of our ability to care and cure. We risk turning back the clock when simple infections could kill. The administration has proposed critically needed investments to better track and prevent antibiotic-resistant infections, accelerate outbreak response, support stewardship programs so that the right choice is the default choice. That's what works best in public health, and to develop new drugs and diagnostics. These will be critical investments. It's a big step in the right direction, and the commitments being made or announced today are really important. They accelerate our progress, and these, together with support from Congress for the request of the President to support programs throughout the U.S., we think really can turn the tide. We think that within 5 years, we can prevent more than 500,000 drug-resistant infections, save thousands or tens of thousands of lives, and save literally billions of dollars in health care. This is not just an issue of the human health consequences. Human health and animal health are intertwined, and it's my honor to turn it over to Agriculture Secretary Bill Sack.
Well, good morning to everyone. I've had this job for a little over 6 years, and what I have learned about agriculture is that it is important, it is complicated, and it is not fully understood or appreciated by a lot of folks. And I think the same could be said for what brings us here today. Antibiotic resistance is important. It is extraordinarily complicated. It's not fully understood, and perhaps not even fully appreciated by the general public. And that's why I'm proud to be part of an administration that is focused on this issue and understands the connection between human health and animal health. We at USDA take this issue very seriously. We have committed a substantial amount of research dollars focused on this issue. We have suggested, pursuant to the President's budget, that we quadruple the amount of investment. And we are doing this in the context of the National Action Plan. It has 5 basic components, and USDA is engaged in all 5. First of all, we obviously need to know more about this whole process. How does it actually work? What is the process in terms of animal health, and how does it transfer and impact human health? So that's why it is important for us to continue focusing on research, an assessment and prioritization of that research, and making sure that we inform producers in this country of the best management practices that will allow us to reduce the potential for this resistance. We obviously have to strengthen our One Health surveillance efforts. To do that, it requires us to focus our time and attention on a central repository of veterinarian information so that we accumulate data, use that data effectively to understand better animal health, and IT systems that will allow us to link labs so that we can better communicate, again, between animal health experts and human health experts. A use of standardized protocols for assessing the testing that's being conducted. We're also looking at advanced development and use of rapid and innovative diagnostic tools, a better understanding of animal health, a better understanding of how we might be able to determine more quickly, accelerate the basic and applied research in this area, which really involves big data, genomic mapping, better understanding of how bacteria basically travels in the animal health system. And finally, better collaboration between agriculture and human health, physicians, doctors, and alike. A better collaboration amongst and between animal groups and farm groups. I want to acknowledge that today there is in the audience a wide variety of areas of our society that are impacted and affected by this. And there are folks who are stepping up in a very serious way in the agriculture business and in the food business to take steps in this collaborated effort. Tyson's, Costco, McDonald's, Cargill, Chick-fil-A, Elanco, a wide variety of interests who are making commitments and focusing their attention on trying to help be part of the solution. But this is a complicated problem, and it's one that we have spent the last 20 years working on at USDA, and the reality is we obviously have a significant amount of more work to do. Last year, we spent over $19 million in research. This year, the President's budget has asked for $56 million. And we're hopeful that Congress understands and begins to appreciate the seriousness of this issue. I know that there are several members of Congress who absolutely do have a passion for this. And I hope that that passion translates into a general understanding of the importance of this issue, and the resources are provided because nothing can be more important. I know that producers are quite anxious to work with their veterinarians to make sure that the use of antibiotics for animal health is used judiciously and appropriately, moving away from an overutilization, which may have been a part of our efforts in the past, to a much more judicious and reasonable use. And I think that producers understand the significance of this and the importance of it. They care about their animals, and they obviously care about their family and friends and community. So I'm here today just simply to reiterate that agriculture is going to be part of the solution, that we are committed to this at USDA, and certainly will continue to work with all of you and the administration to make sure that, as the doctors suggested, that within 5 years we're in a better place than we are today. I think the fact that we recognize the importance of this, that we recognize it's complicated and complex and requires additional attention, and that we've raised the visibility and awareness of this, I think is reflective of the importance we place on it. And I'm, again, proud to be part of an administration where the President of the United States is personally engaged and involved in this, and is directing this effort, and is directing all of his cabinet to be engaged and involved. So thank you very much.
So we're very fortunate to have so many companies here that reflect the full spectrum that's important to address antibiotic resistance. We have now guests at the table who reflect the importance of these issues and the wide breadth of commitment and concern. I'd like to introduce them one by one. Dr. Jonathan Perlin is President of Clinical Services and Chief Medical Officer of the Hospital Corporation of America. HCA will develop and implement new systems to rapidly respond to lab results, identify drug organism or drug bug mismatches, and strengthen national efforts to identify and report cases of antibiotic-resistant infections. Dr. John Loom is Senior Vice President for Medical Affairs for the southern area of Genesis Healthcare Corporation, which will disseminate best practices related to reducing urinary tract infections and unnecessary antibiotic use in the very important nursing home setting. Frank Yanis is Vice President of Food Safety at Walmart, which will commit to humane treatment of and responsible antibiotic use in farm animals. Jeff Simons is President of Elanco Animal Health and Senior Vice President and Executive Officer of Eli Lilly. Elanco will reinvest nearly a quarter of profits in R&D to include more alternatives to antibiotics, such as enzymes and vaccines. And Donnie Smith is President and CEO of Tyson Foods, which recently announced its intent to eliminate use of human antibiotics from its U.S. broiler chicken flocks by September 2017. Thank you all so much for your commitments, and we look forward to hearing from you. Let's start with the greatest challenge that you face to advancing antibiotic stewardship programs in your industry. Can we start with you, Jonathan? And we'll just go right down the line.
Well, first, thank you. I'm John Perlin, and as Dr. Frieden said, I'm President of Clinical Services and Chief Medical Officer at HCA, and also have the privilege of chairing the American Hospital Association, the association of virtually all of America's hospitals and many health professionals. In my spare time, I also serve as advisor to the Secretary of Veterans Affairs as the chair of the Special Medical Advisory Group. In those roles, we have really the responsibility to serve a clinical, ethical, and social need, clinically to assure the best possible outcomes and avoidance of harm, ethically to really make sure, as Dr. Frieden indicated, that we have antibiotics to treat patients, and a social responsibility to assure that we don't continue into a post-antibiotic age. I think that there are many opportunities to do things correctly, and so, Dr. Frieden, if I might, let me just reinforce the commitment of those three organizations to the prudent stewardship of antimicrobial resources. As was heard, any avoidable harm is by definition excess, but excess harm in the form of 2 million avoidable infections and 23,000 avoidable deaths per year. And the context that probably 30%, according to CDC information, of instances of use of antimicrobials are frankly inappropriate. So the commitments, which are directed really at addressing the challenges, are threefold. One, HCA joins with VA in commitment to reporting antimicrobial use to the CDC, and we believe this is critically important to understand not only the nature of the use of antimicrobials, but simultaneously the nature of the infections that we're seeking to treat. VA has already made that commitment electronically, and an HCA as really a derivative of meaningful use. We're using our information systems to make that possible as well. Secondarily, we are committing to a national antimicrobial stewardship program to directly address the challenges that are faced. And the principles that we use in HCA are similar to the principles that are espoused by the American Hospital Association in their appropriate use materials, which is available at the AHA website under the keyword antimicrobial use. Let me address some of the barriers as you asked. And let me just start that the first and most important consideration is really good infection prevention. Dr. Frieden, I believe that if you or I could choose one thing to do in the rest of our career, it would probably be effective hand hygiene. We don't need to be vectors of transmission of infections inadvertently, certainly as health professionals, and it's unacceptable that health professionals may not be as good as passengers on a cruise ship in terms of the consistent use of good hand hygiene. So any good program starts with good prevention, and good prevention starts with hand hygiene. I say that because that is a barrier. We are not as good as we need to be in terms of the hand hygiene and the effective prevention. There are challenges in three categories that I'll speak about in this: general definitions and measurement, provider-related challenges, and implementation. We appreciate the work of CDC in helping us toward agreed definitions of appropriate use. We need to be able to benchmark the use to really be sure that we're not fighting on definitions, but fighting an epidemic of overuse, of avoidable use of antibiotics, or avoidable use of excess broad-spectrum antibiotics. We need better data on optimal dosing and duration. In fact, in our organization, we think of the 5 Ds as the cornerstone: the right diagnosis, the right drug matched to that diagnosis, sometimes called bug drug, the right dose of that drug, the 3rd D, the right duration, not too long, not too short. Either one can result in inadvertent harm to the patient or by breeding antimicrobial resistance to others. And finally, appropriate de-escalation once you have the data, to make sure that you can narrow to the most specific therapy that kills the infection of interest but doesn't create an environment that allows the harmful multi-drug bacteria or other organisms to grow. We need, derivative of that, standardized risk-adjusted measures and benchmarks, and again, the CDC and your National Health Safety Network would be terrific for that. And when I think of measures, really think of them as measures of consumption, the use of antimicrobials, measures of process, how well we adhere to guidelines, and measures of outcome, how well we do in terms of the desired effects, which are good clinical outcomes for patients, and avoidable harmful effects, either adverse events for the patients themselves or the adverse event of breeding antimicrobial resistance affecting all patients and all communities, that friction which you so eloquently spoke about. Provider-related challenges, frankly, I'm a physician, I'm an internal medicine physician. We need to be more accountable, we need to be held more accountable. Physician and health worker knowledge is not as contemporary as it needs to be. Again, the CDC, HHS, AHA, medical specialist societies, and all the societies in infectious diseases really are sources of education. That needs to be an accountability for receiving that education. We need to be measured in terms of our practice of that. There are times where there are incentives that work across purposes. Let me give you an example. Patients increasingly and unfortunately have adopted a belief that they need antibiotics at times when they're really not necessary. We need to do a better job of educating, because the incentive that physicians and hospitals work under is one of patient satisfaction as well. We want to satisfy the patient. I like to personally explain that the most satisfying course is the best possible outcome. It takes time, but we need to recalibrate this potential mismatch of incentives where there's an expectation for antibiotics or other antimicrobials when in fact they're not necessary, and that leads to a challenge patient education. And finally, in terms of implementation, we may have great knowledge, but we need equal knowledge in the field of formally studying how we change clinical behavior, how organizations such as my own, such as the member organizations of the American Hospital Association, how VA change patient behaviors, change provider behaviors, and change institutional behaviors. And the Agency for Healthcare Research and Quality, along with CDC and other elements of HHS, professional societies and others have an interest in that. Through that, they can really support educational programs and best practices, coherent antimicrobial management programs that span settings, outpatient, inpatient, nursing home, home, and community, that span the transitions of care between those different parts of healthcare and home, that span not only the provider domain, but work with payers who are represented here later today, and that support really adherence to the most appropriate indications. So those are the challenges, and I look forward later to talking about how we're tackling those challenges through our commitments at the American Hospital Association, in my home organization, HCA, through a commitment to reporting, a commitment to antimicrobial stewardship and prevention programs, and a commitment to working with you in research, and in the VA through a commitment to prudent prescribing practices and reporting, and really also serving as a laboratory. So thank you.
Thank you so much, John. And this really emphasizes the importance of a whole of society, not just whole of government, but whole of society approach. We have patients, doctors, institutions, payers, all of them important to generate data, have the stewardship, have a partnership to reduce antibiotic use. And of course, it's not just human health, but animal health as well. Jeff, in the animal health world, what are we looking at?
Yeah, I think we're pleased to be here, and I know on behalf of really the animal health industry in a broad sense, it's to bring both industries together, the human health leaders and animal health. I think there's an opportunity today really to create a platform on this key issue. The concern over the reduced effectiveness of antibiotics is real, needs to be addressed. I think we're really looking to shape the future, focusing on how we can continue to really bring the importance of the health of the animal into the One Health discussion, and how it links to human health, our food chain health, and the environmental health. I think that's important. So this is really about, I think, putting One Health to work today. Let me back up, though, and just say I think the FDA has made great progress. Today's announcement on the VFD is an example of that. It's important, I think, though, to understand a little bit of animal health. We look at antibiotics really in a shared class and animal-only class. Shared class being those that are used in both humans and animals, then animal-only that are only used in animals. And I think it's important to have a little bit of a dialogue today on that. The FDA has made strong progress with guidance 209 and 213, where really limiting the use of shared class antibiotics, moving it only to therapeutic class, phasing out growth promotion, and increasing vet oversight. And that actually was instituted today even more so with this VFD. I would say that all 26 animal health companies have voluntarily confirmed our commitment to comply with these measures, and there's good progress. I think animal-only antibiotics do create a positive solution where the treatment and the well-being of animals can be done with animal-only antibiotics, and this also can then continue the longevity on the human side. So I think that's important. You know, I'll just highlight, I think, what probably is the biggest barriers we're talking about, as Secretary Vilsack said, science and disease. And I think we need to be very careful. So I think the biggest challenge is we must not enact regulations or policies, you know, that would move faster than the science. We can't get ahead of, I think, the science and the solutions and jeopardize animal health, jeopardize food safety, jeopardize food security. I think this is important. Setting timelines without solutions, and I commend the companies here and others that were mentioned today on not doing this, but setting the right timelines. But setting timelines without solutions could be dangerous, compromising animal welfare. For example, policies that require complete elimination of all antibiotics in animal production, aren't right for the animal or not right for the consumer as well. So this is a challenging endeavor, not without risk, but I think with intentional focus, with some dedicated investment, with a collaboration from today's discussions, I think we can make progress. We believe that there is a positive future both for the health of humans and animals, and I can share later our commitments that we've made today and announced today relative to this later on.
Thank you so much. Real progress here, real change, and it affects all of us as we consume food and as we participate in medical care. We've got Walmart here, such an important retailer, wholesale, that the enormous impact that you have on our entire food supply, I think often not only is it a significant proportion of the food supply, but it drives the market. So thank you for your commitment, Frank.
Well, thank you, Dr. Frieden, and we'd like to thank the White House and the administration for being part of this session. First of all, at Walmart, we are absolutely committed to providing safe, affordable, and sustainable food so people can live better. And so our position on antibiotic stewardship is consistent with our commitment to continuous improvement in sustainability and a sustainable food system. When our customers shop in our stores, they expect great prices and great products. But our customers have told us that they expect us to source products and food in particular in a way that's sustainable for the planet and for people. And so that's why about a week ago we made an announcement regarding our antibiotic position, and it was based on 3 basic pillars. Number one, we're asking all of our suppliers, whether they provide us with foods that are meat and poultry products, seafood, dairy, eggs, to use antibiotics very judiciously and responsibly. That means that they should use them only to treat or prevent disease in animals, that they should use them with veterinary oversight, that they should keep good records, and that they should document outcomes. And so that's very consistent with the principles of the American Veterinary Medical Association. Number 2, we're asking our suppliers to not use antibiotics for growth promotion, and especially not use medically important antibiotics for growth promotion. And as you know, that's very consistent with FDA guidelines. But number 3, we're asking our suppliers to work with us to promote transparency in how antibiotics are being used in the food system. And so we've asked our suppliers to report to us on an annual basis how they're using antibiotics, how much antibiotics they're using, and for what purposes. And that we're not only asking them to report it to us, but we're asking them to make that report available to the general public. We think that's important because we know that transparency leads to accountability. And we also know that transparently leads beyond to accountability to responsibility. It tends to regulate self-governing or self-regulating behaviors. And so that's why we're strong proponents of transparency. In terms of the question you asked, Dr. Frieden, in terms of challenge, the one challenge that I can think of is just the challenge of changing. Change in general can be difficult. And so if you think about a food system and food producers that have been doing things one particular way for many years, knowing what type of yields it provides, the efficiencies. If you ask them to change, there are questions. There could naturally be questions about what type of yield might I achieve? Am I going to see the same efficiencies? Will I see more sick animals? And so just like there are barriers to progress, there are enablers. And so I'd rather focus on the enablers of progress. And there's 2 key ones that I see. One, as mentioned here today, information sharing. There are others that are a little bit further along on this antibiotic stewardship journey. And so if they can share the lessons learned, some of the pitfalls, what's working and what's not, the innovations that they've used to prevent disease in the first place that lessen the need for antibiotics, that benefits everyone. And the second one, as I mentioned, I think a real enabler will be this principle of transparency.
I think this is music to our ears in the human epidemiology field because we do think that sunlight is a great disinfectant. And transparency is really important. When we have, whether it's infection rates in hospitals or antibiotic use for different purposes, it drives progress in a way that keeps everyone in the game. And we are really honored to have Tyson here. Donnie, I know that you are not a Johnny-come-lately to this area. It's been a focus for you for some time, and we thank you for your new commitment.
Thanks. So thank you so much, Dr. Frieden. And we have made a lot of progress over the last few years, reducing human use to antibiotics in our poultry value chain by 80-something% over the last 4 years or so. So addressing the challenge issue, really what we need are more alternatives. You know, whether it's, and we depend on companies like Elanco and the animal pharmaceutical industry and great research and veterinarians and the academic community and others to help us find, whether it's an, you know, an enzyme or botanical or probiotic or that type, or it's, as Jeff mentioned, these animal use only antibiotics we think are very important to making sure we keep that balance between this global health concern and our commitment to animal welfare and to something Frank said, and keeping that product affordable, right? That's a very delicate balance. And so being able to straddle that fence, so to speak, by finding more alternatives. I loved hearing what the Secretary of Agriculture said about increasing the research budget. We need more research on what these alternatives might be. And we've got great partners all through the, you know, animal and livestock industry that are eager to make progress on these issues. And as we find more alternatives and we can put them into use, we'll make a lot of progress on this issue.
Thank you. And as you mentioned, the proposal for the FY16 budget has a significant increase in funds for research in this area in the animal health, and also for funds that we would provide to every state in the country to have prevention programs out there to detect, also to learn more about the human health aspects and what can be done, because some of the challenges that we have, we know how to address, and it's just a question of implementing. Others are more difficult, and that takes us to John to look at the long-term care nursing home sector, which is one of the areas where we know that there are many infections, and many of them we know how to prevent, but some of them are tougher. So
yes,
share your perspective, please.
Thank you, Dr. Frieden. I want to thank you as well as the CDC for reaching out to us, Dr. Stone, bringing us all together. We are at Genesis Healthcare. We're the largest provider of SNF and long-term care in the country, and now have a national footprint of over 500 centers. This is music to our ears, Dr. Frieden, because we have been committed to, really what this is about is responsible and sensible prescribing. We have resources within our company already where we've been working on this with, we have expertly trained nurses in our centers who have infection control background, training, certification. We work closely with we hire pharmacists and have pharmacy partners as well as our pharmacy provider to help us with sensible and responsible prescribing. So what we're looking, I guess, for the CDC for is to work on logistics, breaking down barriers, and further guidance in that area. I am also an internist, and one of the things we teach our providers is, in accordance with the ABIM Foundation, is the Choosing Wisely campaign, which very much espouses a lot of these principles about sensible prescribing. And our partner organizations, American Healthcare Association, the American Healthcare Association, and AMDA, American Medical Directors Association, are committed to this as well. And American Medical Directors Association has, as part of their advanced curriculum training, many things related to antibiotic prescribing and antibiotic stewardship. So this is something very much that we are committed to. And as far as the barriers go, I think things like this help break down the barriers. It's really the things about collaboration and communication that bring us together and to talk about these things in this kind of a forum, and continuing to work towards the common goal are things that I see as being common barriers. So thank you.
Thank you so much, and it makes such an important point that the best treatment isn't the most treatment, it's the most appropriate treatment. And yet that's sometimes a real discussion that we have to have with our patients. Let me ask each of you, do you think there's a business case for antibiotic stewardship and antibiotic stewardship programs? John?
Well, thanks, Dr. Frieden. And This is one of the great unappreciated ironies. It's something that's been driven home to me in VA. It's something that's driven home to me in my day job at HCA, Hospital Corporation of America, and something we know across the American Hospital Association. Good quality is good business. Let me put it like this. If we were making cars and we had a complication, an error, and you had to rework it, that would be an unnecessary expense. This is what happens with poor choices of antimicrobials. An avoidable infection is not only costly and potentially the ultimate price for patients, expensive for communities, but it's in practical day in and day out terms an excess expense. In our home organization, as we track those 5 Ds, the choice of making sure that we have the right diagnosis, choosing the right drug, appropriate dosing, duration, and de-escalation, those sorts of activities correlate with cost per patient day. So it's really clear that there is an immediate business case for quality in this regard. The American Hospital Association has an extraordinary example. With the support of HHS, the American Hospital Association set forth with the largest collaborative hospital engagement network. And in the hospital engagement network, working on healthcare-associated infections, antimicrobial stewardship, and other hospital-acquired or healthcare-associated complications, AHA's work across many states not only avoided in excess of 90,000 adverse events, but saved the better part of $1 billion. In fact, the conservative calculation was that the savings were $988 million over the period of operation of those hospital engagement networks. That's real money. But as I mentioned, the real cost is to patients. Let me just direct you to the specific website for the AHA resources, www.aha.org/appropriate use. And that will take you to that resource. Really, to get to that business case, though, requires putting into process a set of interventions for appropriate antimicrobial stewardship that are centered around not only the education, but the measurement. And with that measurement of the use or consumption of antimicrobials, the process measures, adherence to guidelines, and that sort of thing, the outcome measures, the effect of cures of patients, measurement, hopefully, of decreasing adverse events. There are also financial measures. And here's the really remarkable thing. Because these broad-spectrum antibiotics that tend to be overused or used too long are more expensive, the proxy measure for your entire program is actually a decrease in cost of antimicrobials. Good quality, good safety, good stewardship is great business.
Thank you so much. Doing well by doing good, it sounds like, and it clearly intersects with the direction that Health and Human Services, under Secretary Burwell's leadership, is going in increasing the proportion of our care that's based on value-based purchasing rather than volume-based purchasing. So there's an intersection here of what we're doing to try to make sure that what pays is also what helps people stay healthy and become healthy. Jeff?
Yeah, I think it's a great question, and actually, we're part of Eli Lilly, a pharmaceutical company that's been in business for over 140 years, and our mission is to make lives higher quality, longer lives is the mission of our company. And right along with diabetes and cancer and Alzheimer's is animal health. So I say, actually, animal health to us is we are in the people business. We provide suppliers like Tyson with products to make animals healthy, which create safe, abundant, affordable food. That's ultimately what we are about. So, today we've announced things that are already in place and some additional extra intentions, and I think this is really our business case today in terms of what we're doing. We've got an 8-point, and I think this word stewardship is very ideal because it's all about stewardship, and how we steward the health of animals into this equation is going to be absolutely critical. So here's what we're really committing to is, one is, I think, further execution of guidance 209 and 213 by not just looking at this in the U.S. I think we've got to broaden the context in our discussions today to talk about this global issue and take it globally. And I think putting together training, which is already occurring, and antibiotic responsible use policies. That to me is absolutely critical across the food chain. And two good examples sitting here today. Number two, Elanco has ceased all promotion of growth promotion for any shared class antibiotics. and we'll have that in the regulation and labels by the end of 2016. Third is eliminating continuous use of shared class antibiotics. We know that's a concern. And working with suppliers on alternatives. Not easy, but that's our goal, is to remove continuous use of shared class antibiotics. The next one is eliminating over-the-counter OTC shared class antibiotics. This is something that's above the guidance globally, including even injectable products that are shared class where veterinary oversight exists. I think the other one is eliminating, there are places where concurrent use of shared class antibiotic is used to treat the same disease, and we're working to eliminate that. Supporting vet oversight. I think today's announcement with the FDA and the CVM is very critical, is how do we put the right infrastructure together. The VFD, the Veterinary Feed Directive, is an example of that. The next are really around just innovation. And the two areas of innovation is developing new animal-only antibiotics. I think is a way that no animal should ever be treated with a shared class antibiotic when an animal-only option exists. And then lastly is today we're being very intentional by saying we're going to create antibiotic alternatives. And I know other animal health companies are doing very similar. But Elanco commits to invest 2/3 of our food animal budget that would match numbers that were shared today. To quickly evaluate, today we have 25 candidates in our pipeline that are non-antibiotics, and our goal is to deliver 10 viable non-antibiotic development projects that address diseases. And these would come from platforms like vaccines, immune modulation, enzymes, and novel therapies across chickens, pigs, and cattle, and enteric and respiratory disease, and also mastitis in cattle. And in 1 year, we'll host and share a forum with the right parties, an Animal Health Accountability Summit to share our progress. So I believe that, Dr. Friedman, we believe strongly that there are solutions, there are pipelines, there are options, not just in Elanco, but I know in the animal health industry, and working together is critical. I think predictability, having things like ADUFA, the Animal Drug User Fee Act, is absolutely critical if we have predictability and we have prioritization put on products that are non-antibiotic solutions in the innovation is going to be absolutely critical going forward to make this business case a reality.
Thanks, Jeff. And the importance of innovation and the breadth of your commitments is impressive. In the human health field, we look at vaccines as an example. Vaccines save $3 in health care costs for every dollar that they cost, and $10 in societal costs. Vaccines are one of the greatest accomplishments of the last 100 years, and they prevent infections. No infection, no antibiotic-resistant infection. So expanding vaccines and other non-antibiotic uses is certainly a very important area to go forward on. Frank, from your perspective?
Very good. It's a great question. Is there a business case for antibiotic stewardship? You know, at Walmart, I can tell you that our commitment to antibiotic stewardship is first and foremost based on the principle that it's simply the right thing to do. You heard earlier today about the real human face to this issue, and so it's an important issue of our day. It's an important medical challenge, and we're a responsible retailer, and we want to do our part. So first and foremost, it's simply the right thing to do. Secondly, it is good for business and our customers. We listen to our customers continually, and our customers have told us they want us to source and provide foods in a way that's sustainable to people and the planet. So listening to your customer is always good business. But lastly, if you think about the challenge that we're talking about this morning, complications in human treatment because of antibiotic resistance, whether it's a person that's sick and they're a customer, whether it's an employee, whether it's someone in the food system, whether it's just a person at large in society. You know, these illnesses have consequences and clearly direct and indirect implications for business and commerce. And so we do believe that antibiotic stewardship is good business and that it's good for business.
Donnie?
So it's been interesting as we've walked down this path and been very, very intentional over the last 4 years to reduce human-use antibiotics. We've actually found a cost benefit by the mechanisms that we've put in place to reduce the use. So often drugs that are not broad spectrum that are suited for a particular disease at a particular time for a short period of time, it's cheaper to use, and all these substances that we use are expensive, and so when we can find ways, whether it's through animal husbandry, the technology of the housing that modern animals are produced in today is phenomenal, and that environmental impact has a huge impact on their health and in keeping the cost low. So yes, there's absolutely a business case for that, and maybe to the point that Frank just mentioned, and I'll just add one point to that. Anything we can do to reduce concern on the consumer's behalf of the food they choose, because think about it, we're what, 2, maybe even 3 generations off the farm today, and as the Secretary started the day, what we do is pretty complicated and it's not widely known, and so consumers today aren't as informed maybe as they would have been 3 or 4 generations ago about how their food gets to the grocery store. So the things that we can do to reduce that concern are good for all of our businesses.
John?
Yes, Dr. Frieden, there is absolutely a business case for this on our side as well. There's a tremendous primary monetary savings in making sure that we're doing the right thing, and it's great when doing the right thing at the same time, and being responsible, that good things follow on the business side as well. So that does not happen very often, but when it does, it's great, and it's great for us too. There's a secondary case also that has been alluded to as well, especially in the human arena with all the adverse events, especially in the SNF and long-term care industry. We see primarily urinary tract infections being overdiagnosed tremendously. Trying to teach our providers and nurses to stick to dose duration and diagnosis, and figuring out, are we treating an actual urinary tract infection? Are we using the correct dose, and are we treating for the correct duration, is very important. And when we do that, obviously all the positive secondary things will follow, but when we don't do that, we don't follow that path, we get into trouble with a lot of adverse events, especially in our industry. So if urinary tract infections are very common, the common thing we see with over-prescribing and irresponsible prescribing is Clostridium difficile infection, and what that's done over the last 10 years especially. Again, a great primary case monetarily, and even probably better case secondarily from the clinical aspect.
Thank you. One of the things that's so striking to us when we look at the problem of antibiotic resistance is that in the human health arena, at least, no one institution can go it alone. If you're the best hospital system in the world, but you're working across the street from another hospital or a nursing home or a private clinician who's not using antibiotics responsibly, you may have to bear the brunt of that problem. And that means that there's an interest in all of us working together across communities throughout the country in animal and human health. And that brings up the role of government. And we're from the federal government, and we're here to help. So how can we help most effectively? What can the federal government do to advance this as effectively and rapidly as possible? John?
Well, Dr. Frieden, I can't think of a better way to highlight this, not only issue, but honestly opportunity. An opportunity to recalibrate our practice, the opportunity not only to avoid harm, but the flip side of that, which is really to improve health and health care. So this White House forum is an extraordinary opportunity. As you mentioned, it spans sectors. It spans the different elements of the human health environment. It spans the pharmaceutical industry. It spans the animal health and agricultural industries. So I think there's an important convening role that's so well served today. But let me offer some specific suggestions about what I believe that different elements of the federal government and frankly the state and local health officials in conjunction not only with their community partners at hospitals but major infectious disease organizations can do. Patient and community education. I mentioned the challenge of the relationship where we have a society now that believes a medication is always necessary. Sometimes the best medication is no medication. Sometimes the best approach is really prudent stewardship. And that's something that we need to work with. And I believe starting at the highest levels of government, as this forum offers, down to state and local health departments, there's an opportunity. There's an opportunity with great industry partners to help educate and inform, because they want their products to be as effective as possible, as they will be when they're used as appropriately as possible. We believe that your role at CDC in terms of providing effective surveillance and response is incredibly necessary. And I know we sometimes like to think of CDC as belonging to us, but honestly, CDC is a resource for the world. And this is not just a health threat in a community, in a state, in a region, in a country. It's a worldwide issue. And so the work that you provide in terms of convening and coordinating response and surveillance internationally is critically important. There are some that suggest we need to be stricter, and Secretary Burwell was here, and colleagues from the Centers for Medicare and Medicaid Services are here as well. And they'll have to consider whether antimicrobial stewardship programs need to be a part of a condition of participation. Certainly the accreditation bodies like the Joint Commission and others can help work to assure accountability. I think the terrific advance that's been made in electronic health information with meaningful use and high tech provides an opportunity to really deliver what I like to call the data dividend. Guess what? We've bought the plane. We've got to fly it. That plane is a cargo of health information that includes information about all the infections we treat and all the medications we use. And as VA is doing, as HCA, Hospital Corporation of America, commits to doing, as chair of American Hospital Association, as I hope to use my pulpit to encourage my colleagues to do, just to use that electronic information to share with CDC and HHS so that we don't have to have a lot of manual surveillance systems, but in as close to real time as possible, we have the opportunity to examine antimicrobial use and make it better. And so there is a real opportunity from high tech and meaningful use, and the Office of National Coordinator would own that responsibility.
Thank you. I want to be sure to get to everyone. So, Jeff?
Just a quick couple comments. First of all, I think today's a great example. I think the animal health industry welcomes, and we hope we're a little disappointed we might have to separate in different rooms because we'd like to collaborate more together. I think this opportunity and hopefully this forum leads to more. I think, as I've already said, I think accelerating at the appropriate way regulatory approvals. An animal new drug application is as complex, if not more, than humans as we look at food safety, animal, environmental, beyond the efficacy of the product. I think the ADUFA that Dr. Dunham and others have done has been very effective in doing that, keeping standards high but creating predictability. My challenge would be very similar to in the areas of human pharmaceutical priority review relative to any antibiotic replacement ought to be considered. That's something that I think the government ought to consider. I think the modernizing data collection. Today we're collecting volume and sales data, and one challenge is we've got emerging diseases in different species and different environmental conditions, and the one challenge is I think we need more meaningful data around the demonstration of responsible use. Are the policies in place and are they being adhered to? The impact on resistance development, and even just the effect of animal health outcomes. So I think our measures need to shift a little bit and need to be focused on things that are the leading indicators to the challenge. I think the other one is just, as I said, let's not get ahead of ourselves with policies before the science. And then I think, let's standardize this at a national level. It concerns me and worries me when we have different municipalities at the state or city level. This needs to be national and global, I think, as we attack this problem, and it can really, break and fraction our efforts if we're looking at this at a state level. So, and I think the last thing is just intellectual property protection, just like in human pharmaceuticals, is critical. It's part of the business in terms of if you want increased investment and a flow of innovation, intellectual property protection needs to be, I think, adhered to and continued to be important. Those are things I think the government would help us with.
Thank you. Frank?
Great. In terms of what the federal government might do better or differently, first and foremost, let me stress that antibiotic stewardship is a shared responsibility. Let me repeat that. Antibiotic stewardship is a shared responsibility. As you mentioned, Dr. Frieden, there's no federal agency that can do this alone. There's no company that can do this alone, no medical institution, no academic institution. And so we need all hands on deck pulling in the same direction. One of the things Dr. Frieden and his agency like to state, there are some battles in public health that are winnable battles. And while this will be a long and difficult battle, we do believe that the battle against antibiotic resistance is a winnable battle, but it's going to take a lot of people pulling in the right direction. And the federal government has done their part. This is a perfect example. We commend the White House and the administration for today's summit. The White House is a great convener, bringing stakeholders to the table. And so what you're seeing today is a louder or bigger conversation on antibiotic stewardship. Brilliant. We thank the FDA for what they've done with the guidelines that they've published. And in fact, it's informed and shaped our thinking and what we're doing about it. We thank the Centers for Disease Control with all of the work they do in terms of tracking organisms, and certainly the Get Smart program, and the USDA with the work they're doing. If there was one thing I might suggest that might be useful, as you've heard today, we're putting a lot of emphasis on this issue of transparency. And so any guidance or direction on how companies could voluntarily report usage in standardized formats and standardized rates or metrics so that we can compare how one company is doing compared to another, we think that would be beneficial.
Great. Thank you very much. Donnie?
So quickly, the only build, I just want to come back to research. You know, I think the government could be very, very helpful if they would, sponsor and support research that would help us find these alternatives we need to eliminate human-used antibiotics from the supply chain. The data collection comments that have already been made can't add anything to that. But the more we know about how these antibiotics, particularly shared use or human-used antibiotics, are used today, and help the public understand that many of the antibiotics used today are not used in human medicine. I think that gives them a lot of comfort that a lot of progress is being made. So the more we can do to do those type of things to help the public understand through transparency what's really going on out there will be very, very helpful as we continue down this path.
Great. Thank you. John?
Yeah, I think as far as the government is concerned, there are really three things. One is, again, to solidify the research and what the correct answers are. I think, the other thing is that we would like, especially in my industry, to continue to be brought to the table for collaboration, communication, and to be part of the solution before it comes down in policy and regulation. And I think my industry partners would agree with that, as well as our partner organizations. So, we look forward to that also.
Thank you. I want to thank everyone on the panel and everyone in the room who's worked so hard to get us to this point. You're hearing a lot of the essential elements of successful programs: political commitment, collaboration, open data, continuous innovation. All of these are essential to progress, and all of these are critically important to address the antibiotic-resistant problem. So I would now like to invite to the stage Lisa Monaco, who is Assistant to the President for Homeland Security and Counterterrorism and Deputy National Security Advisor. Lisa.
Well, thanks very much, Tom. And thank you all very much for being here. I think it's terrific to see this forum in place and to see these seats filled with all of you and not with White House staffers at yet another employee all-hands meeting. This is, I think, a much better use for this room. I also want to recognize my colleagues for having been here this morning: Secretary Burwell, Secretary Vilsack, and of course, Director Frieden from the CDC. And I really am heartened and proud that we have so many leaders from such a broad cross-section of American industry here. It's a real testament to your work on this issue to have you here this morning. Now, some of you may wonder, why is it that the President's Homeland Security and Counterterrorism Advisor is here speaking about antibiotics? My father, who wanted a doctor for a daughter, may also be wondering that. Typically, people associate my job with terrorism, cybersecurity, or special operations raids of our military members overseas. And they'd all be correct. But make no mistake, I'm here today on another matter that is vital to our security, our public health security. here in the United States and, of course, around the world. And that threat that we're here to talk about is the growing threat from antibiotic-resistant bacteria. There was a time, as you all know, when a simple cut or a small break in your skin could mean death. The treatment for infections and blood poisoning was often just to wait and, frankly, to hope. But with the discovery of penicillin and the widespread production and use of antibiotics, countless lives have been saved. It was a watershed moment in human history when those life-saving developments were made, a triumph of science and medicine that frankly changed the world. But in that victory, we also have created a new challenge for ourselves. Over the past several decades, the use of antibiotics has grown, and in many cases, becoming overused or misused, as I know has been the topic of some discussion today. Bacteria have evolved, developing resistance, and blunting the effectiveness of what at one time was a miracle cure. Doctors have had to increase dosages and find new and more potent drugs to treat diseases. And unless we can slow or stop the cycle of growing antibiotic resistance, we may once again find ourselves in the case where common illnesses and everyday infections can be fatal. Now, this is not a problem that any of us can afford to kick down the road. That's why President Obama said recently, and I quote, "This is a challenge we have to take seriously and invest in now." In the US alone, about 2 million illnesses are caused by drug-resistant bacteria each year, and tragically, some 23,000 deaths occur. This challenge, of course, is quite real. Fortunately, there are some fairly simple steps we can take today to counter the threat. The single most important thing we can do to combat antibiotic-resistant bacteria is to reduce the frequency with which we use antibiotics. Now, as mentioned, I'm the daughter of a doctor, and I remember when I was young, my father explaining to me that not only would antibiotics not work for everything, the common cold, just to name one, but it might actually be dangerous to take antibiotics in the wrong circumstances. Simply by ensuring antibiotics are only used when they're needed, we can improve patient outcomes and reduce the potential for bacterial resistance. But we need to make some changes beyond the doctor's offices. We also have to ensure that antibiotics that are medically important for humans are used responsibly in animals. And I know that's a topic of commitments and discussion made here today. That's why yesterday, President Obama signed a new memorandum to encourage reducing antibiotics in the meat industry. Over the next few years, the federal government will do its part, and the meat and poultry purchased for use in federal government cafeterias will include that from farmers who follow responsible use guidelines for antibiotics. This mission will take us all working together, and we are taking steps that hopefully this forum and others like it can build on over the coming weeks and months. So what are we doing? First, we're giving people the tools and information they need to adopt better practices. Earlier this year, President Obama released a national action plan for combating antibiotic-resistant bacteria, and it outlines the steps the federal government will take to limit the spread of resistant bacteria. The CDC has also developed important guidelines for hospitals to improve their stewardship of antibiotics, and this summer they'll also issue similar guidance for long-term care facilities. We're also trying in the federal government to lead by example, working to make sure our healthcare facilities are in line with standards set by the CDC, including through Medicare, Medicaid, and Department of Defense and Veterans Affairs facilities. To support this work, President Obama has requested $1.2 billion in his budget for 2016. That's nearly double the amount of federal support for programs to combat antibiotic-resistant bacteria. Second, we're raising awareness and educating the public about the risk of antibiotic-resistant bacteria. We need to help people understand that antibiotics are not, in fact, a cure-all. Third, we're improving how we collect and share data about the problem. And finally, as this forum exhibits, we're doing more to partner with all of you. Today, I'm pleased to announce that more than 150 private sector partners and business leaders are making commitments to do their part to curb the spread of antibiotic-resistant bacteria. That includes healthcare providers pledging to improve prescription practices, pharmaceutical companies developing better tests and new treatments, clinical groups cultivating best practices, and farmers phasing out the use of antibiotics to promote livestock growth. These steps are a great start, and today I'm hoping the sessions that you'll have can be used to determine what more we can do and should be doing together. With all the challenges we're facing around the world, from terrorism to cyber threats to natural disasters, slow-burning crises like the rise of antibiotic-resistant bacteria don't always get the front-page attention that they deserve. But this is a serious risk to the future health and security of people everywhere, and we all have to take steps to improve the way we're using antibiotics today so they will, in fact, be effective when we truly need them in the future. Your presence here today and your careful and thoughtful and diligent work on this issue makes clear that you recognize the risk we face. And I want to thank you on behalf of President Obama for being here today, for putting your shoulders to the wheels on this issue, for working together in partnership on this critical issue. And I want to thank you for the work that you'll do today and in the days and months to come. So thank you very much.